librarian with the Fresno County Public Library, and I am here today to do an interview with Brenda Herrera. She is a family care specialist with the Alzheimer's Association, and she's going to tell us what the Alzheimer's Association does and her role in that association. So Brenda, thank you for coming today. I'm glad to have you here. So could you start off by telling us what the Alzheimer's Association does and what your role is?
Sure. Thank you, Jessica, for having me. It's a pleasure to be here and being able to share information to our community. I want to start off by saying that caring for a person with Alzheimer's or dementia often involves a team of people. And whether you are providing daily caregiving or you participate in the decision-making or simply care about someone with the disease, the association is here to help you. The association is available to the community to provide education programs and support services to make help plans and adjustments when necessary. We do partner with other organizations to provide support and education and care to those impacted by the disease. We also partner with the medical community, and we do so through our Alzheimer's Association Connect referral program. And as you mentioned, I am the family care specialist for the Alzheimer's Association Fresno Office, and I provide help and support to families. And I do this through something that we call care consultations, where we do assessments and care planning. We're able to prioritize the needs the family is experiencing, find appropriate resources, and increase understanding about Alzheimer's or other dementias. In addition, I provide community outreach. I raise concern and awareness through education and through our annual walk, and I also work with our volunteers to fully engage them in our mission. We know that Alzheimer's is a big disease and the need is great in our community. It really does take collaboration to support those that are impacted by this terrible disease.
Why is this topic and service so important right now?
You know, Jessica, we are living during difficult times, especially with this COVID-19 pandemic. And for our caregivers, the pandemic poses an even more unique challenge, where not only do they have to navigate through a dementia diagnosis, but they also have to navigate the new ways that their loved one is receiving care. And so we know that caregivers during this time may be receiving less or irregular outside assistance. So this adds to an already high level of caregiver strain. Also, persons living with dementia may have an impaired ability to follow or remember instructions about social distancing. And unfortunately, this does increase their risk of contracting COVID-19. People with dementia sometimes have difficulty with adapting to the disruptive routines they're experiencing during this time. So wandering, confusion, and disorientation may increase. The cognitive impairment that they experience will affect their communication, and especially when we're trying to communicate with them virtually. So therefore, this contributes to social isolation and potentially causing more rapid cognitive decline. And it's so sad to share this, but neglect, abuse, and exploitation may not be detected early if surveyors and adult protective services workers are not able to safely access long-term care communities. So knowing about the disease, being connected to programs, services, and knowing care strategies is very important during these times.
Yes, I agree, it really is. So Brenda, there might be some people who are listening to this today who are facing this issue right now. What do you recommend for someone who's already overwhelmed as a current caretaker?
Yeah, first I want to say that if you're feeling overwhelmed, you're not alone. The Alzheimer's Association is here for you day and night. You can access us through our 24-hour, 7 days a week helpline at 800-272-3900. And the helpline is available at any time to provide information, advice, and support. Our trained staff are ready to listen and can help with referrals to local community programs and services. They can provide you with dementia-related education, with crisis assistance and emotional support. And I know that caregiving can be even more overwhelming when you can't seem to take a break. And some things that I want to share just to keep in mind is to note the times that your loved one is either napping, or if they can have the ability to stay busy with an activity, really take advantage of those times for yourself. Take some time to do relaxation techniques, get moving, do some meditation, maybe call a family or friend. Some tools that I want to share with you, we do have something called the online team calendar, and that can help you organize family and friends who want to provide care and help you as a caregiver at a distance. We also have something called the Alzheimer's Navigator, and this is a free online tool that helps evaluate the needs, identify action steps, and connect with local programs and services. You can access these tools through our website at alz.org, and you'll want to use the search bar. You can either search Alzheimer's Navigator or Online Team Calendar. And Jessica, I want to take advantage of this time and offer some tips for caregiving during this time. If you are a caregiver at home, your loved one may need extra or written reminders to support and to remember the important hygienic practices from one day to the next. So it might be good to consider placing signs in the bathroom or elsewhere to remind them to wash their hands with soap for 20 seconds. You can also use an alcohol-based hand sanitizer with at least 60% alcohol, which can be a quick alternative to hand washing. Also, ask your pharmacist or doctor about filling prescriptions for a greater number of days to reduce the trips that you'll have to make to the pharmacy. And then also think ahead and make an alternative plan just in case the primary caregiver becomes sick. For those who have loved ones in home care, or for those who are receiving in-home care services, it's important to ask your home care agency to explain their protocols that they have in place to reduce the spread of COVID-19. It is essential that you as a caregiver require the care providers to wear a face mask. Have them inform you if they are experiencing any symptoms. Make sure that they're washing their hands, and most important, have them avoid eating at the same time as the person living with dementia. If your loved one is in long-term care or residential care settings, if visitation is not allowed at this time, ask the facility how you can keep contact with your family member. And options could include telephone calls, video calls, or emails to check up on them. If your family member is unable to engage in calls or video chats, then it's important to ask the facility how you can keep in touch with staff to get updates.
Definitely being able to stay in contact with people is really important right now. And those were some great tips and some great resources for people who are currently a caretaker right now. What do you suggest for people who are currently seeing some warning signs in their loved ones and they think they might be a caretaker in the future?
That's a great question, Jessica. And for those who feel like they're seeing warning signs and might be caretakers in the future, I want to start off by saying that you may be feeling unsure of where to go for information, maybe feeling anxious about what to expect as the disease progresses, or maybe you're concerned about your ability to support the person living with dementia. I want to tell you that these questions and feelings are absolutely normal. And one of the things that I want to encourage you is to become an educated care partner. As the disease progresses, new caregiving skills may be necessary. So the Alzheimer's Association does offer programs to help you better understand and cope with the behaviors and personality changes that often accompanies Alzheimer's disease. Another important step is to get an early diagnosis. And when you get an early diagnosis, you and the person with dementia now have the opportunity to make decisions about the future together. And these decisions may include legal, financial, and long-term care planning.
And can you share with us about the online resources that you have and how people can access those?
Sure. So I might have overwhelmed you with all the resources that I mentioned before, but I do want to let you know that most of our resources and information you can find through our website at alz.org. And I'll help you navigate a little bit since there's lots and lots of information. If you click on the Alzheimer's and Dementia tab, you will find information to learn more about the disease. If you click on Help and Support, you will find information and resources for both those living with Alzheimer's disease or those who are caring for someone with Alzheimer's disease. We also offer support group, and our support groups are currently being offered virtually. You may find it helpful to talk to other care partners and caregivers about how they're coping with the challenges of the disease and uncertainty about the future. Having a good support network can help you find advice and encouragement. And you can find the schedule of our support groups either by calling our helpline, and that's at 800-272-3900, or you can visit us at our website, alz.org/NorCal/event. That will take you specifically to the support groups. And something that I do have to mention is that we do require registration. But again, you can register through the helpline or if you go online, if that's your preference.
Okay, great. Thank you, Brenda. That is a lot of information. I do have one more question for you, though.
Sure.
So I hear you offer free educational programs. Can you tell us about those and how can people attend those?
Sure. And like I mentioned before, one of the very first steps is to become educated. So again, the Alzheimer's Association offers an array of programs that will help you understand what to expect, and they will help you prepare for the changes ahead, and will help you have your loved one live well for as long as possible. So some of the topics and classes that we offer are the 10 warning signs of Alzheimer's disease, understanding Alzheimer's and dementia. We have a program called Healthy Living for Your Brain and Body, and that's really to see what steps you can take to prevent this disease and have a healthy life. We have something called Effective Communication Strategies, and this is more for caregivers who are already experiencing Alzheimer's disease in their families, and then also understanding and responding to dementia-related behaviors, legal and financial planning for Alzheimer's disease. And I also want to share that if you are an organization that is watching this interview, we would be happy to partner with you to bring this education to the population that you serve. And of course, we want to thank the Fresno Library for partnering with us. If you are a family that wants to take advantage of this education, which is completely free, you can find our upcoming education programs, again, by calling our helpline, 800-272-3900, or you can also look at the schedule by visiting our website at alz.org/NorCal/events, and you can also register online. And so lastly, I do want to share my contact information. So if you're an organization and you want to partner, you can contact me via email at bkherrera@alz.org or by calling our office at 559-753-8202. And then again, I just want to share our helpline number for our families who are needing the care and support, and that is at 800-272-3900.
Thank you so much for coming and doing this interview. There's a lot of great information that you shared with us. And I just want to let everyone know that the helpline phone number and the main website, as well as Brenda's contact information, will be in the description box below. Thank you once again for coming, Brenda. Have a great day.
Thank you.